Good morning, everybody. It's Mac Armstrong, the Chief Clinical Information Officer for the Trust. I've got some good news to share with you. Last week, we had approval to proceed with the procurement of the electronic patient record, so it is definitely happening now. We've got approval to proceed, and that moves us into the next phase, and the procurement phase is going to take about 3 or 4 months for us to get to having a named supplier, which we will be able to share with you and with everybody else. So that's great news and we're moving forwards, but it does mean that we're moving into the procurement phase, and that comes with it some legal and personal responsibility for all of us that are involved, because there are very important legal and procurement rules about what we can and can't say. So we cannot speak to others, to suppliers, we can't speak to other organizations, and we need to follow the normal procurement processes. Those people who are helping us with the evaluation are going to have lots of training and support to make sure that everybody's doing it properly. And at the end of that, we should have the correct name supplier, and we won't be open to legal challenge. So just to remind you why the electronic patient record is important to us here in Plymouth. At the moment, we've got over 130 different IT systems and a paper record in the middle, and it's not very easy, safe or elegant for any of us to deliver care. And the electronic patient record will sit in the middle and replace the majority of those systems and allow us more time to care, better opportunity to share information, and make it easier for clinicians and staff alike to deliver safe and effective care. The EPR project is something which we're going to be doing together. We're not doing this to you, we're going to do this with you. And that's going to be a journey that we're all going to be involved in over the next 18, 24 months. What that means is that if you're going to have questions, those questions are going to be answered by people in our team, by your colleagues. And also, I'd recommend pointing you at the new digital care site, which is available through the Staff Hub, which has got lots of information on it now. And every time that you ask a new question there, we will endeavour to answer it, so that it's an effective source of truth for everybody to delve into as they need to. So just to say again, this is fantastic news that we've got the funding agreed to proceed for procurement for the electronic patient record. There's lots to do over the next couple of months, and what it means for the majority of people in the Trust will become clearer and clearer over the next 6 months.